Understanding diabetes, a guide to managing your health. Diabetes is a chronic medical condition that affects millions of people worldwide. It is a complex metabolic disorder characterized by high levels of glucose, sugar, in the blood. Understanding diabetes is crucial, as it can have significant implications for one's health and quality of life. In this article, we will explore the different types of diabetes, their symptoms, risk factors, and strategies for management and prevention. Types of diabetes. There are several types of diabetes, but the most common ones are type 1, type 2, and gestational diabetes. Type 1 diabetes. Type 1 diabetes is an autoimmune disorder where the body's immune system mistakenly attacks and destroys insulin-producing cells in the pancreas. As a result, the body cannot produce insulin, a hormone needed to regulate blood sugar. It typically begins in childhood or adolescence and requires lifelong insulin replacement therapy. Symptoms often develop rapidly and include increased thirst, frequent urination, unexplained weight loss, and extreme hunger. Type 2 diabetes. Type 2 diabetes is the most common form and is usually diagnosed in adulthood, although it can also occur in children and adolescents. In type 2 diabetes, the body either doesn't use insulin properly, insulin resistance, or doesn't produce enough insulin. Risk factors for type 2 diabetes include genetics, obesity, physical inactivity, poor diet, and age. Symptoms may develop gradually and include increased thirst, frequent urination, fatigue, blurred vision, and slow wound healing. Gestational diabetes. Gestational diabetes occurs during pregnancy when the body cannot produce enough insulin to meet increased insulin needs. It usually resolves after childbirth, but women who have had gestational diabetes are at a higher risk of developing type 2 diabetes later in life. Monitoring blood sugar levels and making dietary and lifestyle changes are crucial during pregnancy to manage gestational diabetes. Common symptoms of diabetes include increased thirst and hunger, frequent urination, especially at night, unexplained weight loss, blurred vision, slow wound healing, recurrent infections. It's essential to recognize these symptoms and seek medical advice if you experience them, as early diagnosis and management can prevent complications. Complications of diabetes. Poorly managed diabetes can lead to various complications, including cardiovascular issues. Diabetes increases the risk of heart disease, stroke, and high blood pressure. Kidney disease. High blood sugar levels can damage the kidneys over time. Eye problems. Diabetes can cause retinopathy, leading to vision problems and even blindness. Nerve damage. Diabetic neuropathy can cause pain, numbness, and tingling in the extremities. Foot problems. Diabetes can lead to foot ulcers and infections, sometimes requiring amputation. Dental issues. It can increase the risk of gum disease and tooth loss. Skin complications. Skin conditions such as bacterial and fungal infections are more common in diabetics. Management and prevention. Managing diabetes involves a combination of lifestyle changes, medication, and regular monitoring. Here are some essential tips. Healthy eating. Focus on a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Monitor carbohydrate intake to control blood sugar levels. Physical activity. Regular exercise helps improve insulin sensitivity and maintain a healthy weight. Aim for at least 150 minutes of moderate intensity aerobic activity per week. Medications. Depending on the type and severity of diabetes, medication may be necessary. This can include oral medications or insulin injections. Blood sugar monitoring. Keep track of your blood sugar levels as advised by your healthcare provider. Stress management. Stress can affect blood sugar levels. Practice stress reduction techniques such as meditation or yoga. Regular checkups. Visit your healthcare team regularly for checkups and screenings to monitor your diabetes and its complications.